cost of dialysis has increased from 380 Ghana cedis to 491 Ghana cedis in Ghana, and this is devastating for patients. But what does this mean for you and I? Stay with me, let's dive in. Welcome back. If you are joining us for the first time, my name is Mr. Wayne from Wellness HQ, where we talk about everything health and wellness. Yes, in recent times, the cost of dialysis has shot up astronomically. First to 380, and then just this month in May, it has increased from 380 to 491, and patients are wailing. Currently, we have about 1,300 patients on dialysis. What does this 491 mean? It might look minute or very small, but let me break it down for you. Every patient on dialysis needs between 8 to 12 sessions a month. That's roughly 2 to 3 sessions per week. Now, if you do your math, that's nearly 6,000 Ghana cedis in a month. That's big money here in Ghana. And on top of that, it's not a 1 month session. Some patients can be on dialysis for years. And so how can they afford this surge in price? So there's been a lot of concerns. Patients are complaining that we need a reduction in prices. They've mentioned it to the government. Some are complaining to the right authorities. The Renal Patient Association, for instance, has raised serious concerns that already patients are complaining of the high cost of dialysis. Now they've increased it further. Some are turning down sessions. Some are missing their sessions because they cannot afford it. Well, how does somebody get to the dialysis unit? Let's come back a bit. What would take you to a dialysis machine? This is as a result of kidney failure, normally at stage 5 or higher stage. Okay, so the function of the kidney is to filter the blood, to take out the excess or unwanted waste products and then excess fluids, and then pass it out through urine. So normally that's what the kidney does, which is a very important organ in our body. Now, when you have kidney failure, it means that the kidney has stopped functioning as they ought to. And so you need to be on dialysis. What a dialysis does is now to do the job of the kidney, which is to filter out your blood, usually through a tube on one arm, to pull out the blood, filter it for you, and then recirculate it back into your body. So the dialysis now becomes sort of your new kidney to make sure your blood is working as it should. Okay, and so if your kidney is not functioning, you are put on this dialysis, which can last you, a session can last you about 3 to 4 hours. So 3 to 4 hours for at least 2 to 3 times a week. What can we do? I mean, there's been several calls to the government to do something about this because patients cannot afford it. Let's not talk about the hardship in the economy already. So there's been calls to the government. There will be a parliamentary sitting. So we are hoping that the select committee will raise this issue and probably tell us more about it, whether there will be subsidies or whatnot. What can the government do? I think we need to look at it. Now, they can subsidize, as I mentioned earlier. They can perhaps bring in more dialysis machine. I think the Konfanoti Teaching Hospital, for instance, has installed 3 new dialysis machines, and then they intend to do 12 more. And this is under their Konfanoti Teaching Hospital Health Project, I think spearheaded by His Majesty Otumfo. So more of these can be done. But there is some good news. The National Health Insurance Scheme has promised that effective 1st June this year, 2024, they are disbursing 2 million Ghana cedis to support dialysis. And so they intend to do this at some selected hospitals, Kolebu, Konfuanochi, Kumasi, and then Cape Coast. And so they hope that with this 2 million, and this for a period of 6 months, and then maybe after 6 months, hopefully there'll be more cash to support patients on dialysis. So I think more can be done by the government. This is good, and we need to applaud them for it. The second group of people who can help, I think, is the private sector. Companies can take it upon themselves to do CSR to support these vulnerable patients on dialysis. Imagine being on dialysis machine 3 times a week for 12 times a month for 1 year, what job can you do to cater for this cost? So private sector's businesses you can support. In February, for instance, the Just One Group donated 500,000 Ghana cedis to support some of these patients on dialysis. So more companies, I know there are a lot of private sectors doing this. So we just encourage many of you to support these patients on dialysis. Well, now you and I, what can we also do? I'm sure as friends and as NGOs or volunteer organizations, we can also do something to support dialysis unit entrepreneurs, innovators. If you can come up with other innovative ideas, that'll be fine. But the part that I'm interested in, if you do not have kidney issues yet, what can we do to avoid getting to such critical stage? Usually we call the stage 5. Kidney failure, mostly, aside you being born with it, has some risk factors. Hypertension, diabetes, obesity are some of the risk factors of kidney problems. And so what can you do? We need to follow a healthy lifestyle. We need to be active, avoid sedentary lifestyle, your dieting, reduce alcohol intake, excessive smoking should be reduced, for example, or stopped drastically. All right. So what can you also do? You can also do a medical checkup once or twice a year. You can do a kidney function test. And this is very important that everybody does a kidney function test at least once or twice a year to know the strength or status of your kidney. It can be done easily. You can walk into a hospital and just have it checked at a diagnostic center, or you can book an appointment with Express Med Healthcare, where their lab technicians can come to your home or office and run a test for you, and then at your convenience, and then a doctor will interpret this for you and then advise if need be. So that is it. There has been an increase in the cost of dialysis from 380 Ghana cedis to 491, and it is causing mayhem in the country. Patients are complaining. The Renal Patients Association is complaining. Government has promised to do something about it, and we are encouraging and are calling on all the private sector CSOs, everybody to jump on and help address this issue. And so stay with us. We'll give you further updates as and when it drops. If it's your first time joining us, don't forget to hit the subscribe button and then share to your friends and loved ones. All right, catch you another time. Bye.